Good morning, everybody. We're going to go ahead and get started. So first of all, just want to thank everybody that's able to be here. And I know that those that are not here, we wish that you were here, but thank you for tuning in. My name is Julie Morgas-Baca. I'm the Bernalillo County Manager. And today is a great day for our community and for the International District. So we are here at the CARES campus. And when we first occupied this building, it was our goal to create an extensive substance use care system for our community. The system included substance use programs, both in the community and the Metropolitan Detention Center. So just know we're also serving the folks over at the jail so that they can, when they're released, they can have a place or a program to go to when they need care. So we wanted to just give this community the best tools that they needed addressing their substance use issues. So before I kind of get into the meat of everything, I do want to acknowledge some folks that are here. I really appreciate you don't do anything. It's just not the county. It's just not a few people. It's a lot of us that are together that are doing what's right for the community. So I'd like to acknowledge Councillor Gibson is behind me, Councillor Bassan, and Councillor Sana. And we want to thank you all for being here. Thank you so much. And I also want to acknowledge Deputy Director Gilbert Ramirez for Behavioral Health. Thanks, Gilbert. Thanks. We meet a lot with Gilbert. We talk about strategizing and working together. And I just want to say it's just been a really good collaboration with the city. So as tomorrow marks the beginning of September, which is celebrated as National Recovery Month as well as National Suicide Prevention Month, we recognize the work that our department has accomplished in an effort to support our community, of which many individuals are suffering from the effects of substance use and suicide. A very, very sad and hard reality, but we're not going to ignore it. We're going to do something about it, and we're going to work together with all our partners to address these growing needs. So I'd also like to thank the project management team for their dedication to making these important renovations. So I just thank you so much for everything that you've done. I know that it's been so much work. I see Chief Pettis is behind me. Thank you, Chief, for all your support, for your supporting your staff. And Margarita, thank you for being our fearless leader in the behavioral health department. You've done a great job. So we're just here together as a community to show that we can collaborate together, we can work together, and we can continue to provide the best possible services for our community. So at this time, I would like to invite Madam Chair Charlene Piscotti to come up and say a few words. And Commissioner, I just want to thank you for your support, because without your support, we wouldn't be standing here today. So thank you so much, Madam Chair.
Thank you, Julie. First of all, I want to join Julie in thanking the Bernalillo County Department of Behavioral Health Services for continually making this program a success. I have had the opportunity to visit the space prior to the renovations, and I can tell you firsthand that these changes have given the detox facility a more home away from home feel. Individuals supported at the CARE campus are extremely vulnerable as well as courageous for taking this important first step to recovery. The first few days of detoxing from a substance can be very challenging. The premise of going cold turkey is often unrealistic. So the support of the department team and the important relationship we have established with the University of New Mexico Hospital is paramount in ensuring that individuals are safe. This additional space and renovated bathrooms and showers give clients the dignity and comfort they deserve during their recovery journey. The renovations also include semi-private rooms for individuals who are further along in their detox and have reached a level of stability that allows for increased client dignity and a greater opportunity for client engagement and services. This project included a build out of a brand new building with increased health and safety measures for clients and staff. This includes a centralized nursing staff station for consistent, clear line of sight, anti-ligature fixtures and equipment, new beds for clients, and a centralized pharmacy. The multitude of services offered to the clients during their stay is remarkable. These services include medically enhanced social model detox, medication-assisted treatment, case management, recovery planning, and follow-up. As a licensed mental health therapist myself, I know firsthand the importance of case management and active engagement in services. I am proud to see these services continue to support some of our most vulnerable populations. At this time, I'd like to share the stage with Deputy County Manager of Bernalillo Public Safety and Chief of Fire and Rescue, Chief Rick Perez.
Thank you, Madam Chair, and all of our distinguished guests here this morning, or actually this afternoon now. It's always an honor when we get to stand before individuals in our community and announce something as incredible and exciting as an addition or an additional build out to the continuum of care for our first responders. This is one of those things that really will help the men and women in both the fire uniform and the law enforcement uniforms. As another area for which we can direct individuals that we come in contact with for immediate services. So again, super exciting that we are here today and getting to unveil this great addition to what continues to be one of the most impressive centers in the state. And this would not be possible without the fearless leadership and direction of the director, and that's Margarita Chavez-Sanchez, who I have the privilege of getting to work with and will be introducing, or probably introducing here in just a moment. But I also need to do a special thank you to all of the men and women who keep the lights on and keep the doors open on this facility 24/7. Through COVID, it has been extremely challenging. We have not skipped a beat. And I am extremely proud, as I know our county manager and our commissioners are. So without further ado, it's my great privilege to introduce Margarita Chavez-Sanchez, the director of our care campus.
Good morning, everyone. Thank you, Chief. Thank you, Manager, Madam Manager, and Commissioner, counselors, and Gilbert. Thank you all for being here. This really is an exciting day. We've had this dream and this vision of expanding this campus for about 4 or 5 years now. So it's really exciting to make this a reality. I also echo what Chief Pettis has stated. The boots on the ground are what has made this possible. Our techs, our case managers, our counselors, our clinical managers, our special project coordinators, our assistant directors, our maintenance crew, everyone has been here every single day through COVID. And it has really been a testament to the reason that we have been able to maintain this project throughout. Even with COVID, we added additional safety precautions in the new unit. But again, there was not a time that we had to completely close our doors for an extended period of time. We were able to resume service at any time that we had an exposure. We mitigated those risks and remained in operation as soon as we possibly could. Here at the Care Campus, as a 24-hour facility, we serve about 15,000 clients annually through our detox program. Again, throughout this pandemic, we have been able to overflow into admin areas in order to maintain that capacity. This new detox unit allows us to further collaborate with partners and providers in the community. I think it's important to recognize our partners at the University of New Mexico Hospital who are providing our medical intervention, including the expansion of medication-assisted treatment. We now have 24-hour nursing, which has allowed us to increase our capacity for first responders to bring clients. For many years, we have heard from the community that first responders couldn't bring clients here for one reason or another. But the addition of that 24-hour nursing and this new expanded capacity and additional safety measures is allowing us to really meet that need in the community. Not only will these renovations increase client dignity and independence, but it will enable the county to launch new programs within the care campus. We're excited about the upcoming observation and assessment unit, an outpatient clinic, and a living room peer-based model, which again help us expand the capacity and comprehensive services here on the care campus. Thank you all for being here today. And with that, I again just want to recognize some of the DBHS staff hiding in the corner, of course, but all of the staff, our assistant directors, our financial administrator, Jessica Jaramillo, who's our special project coordinator who oversees all operations. She probably works at least 80 to 90 hours a week. So just want to recognize all of the efforts from the team, including Studio Southwest and Longhorn, as well as Tommy and his team who are here every day, cleaning up possible COVID exposures and really working to make sure that we are safe here on the campus. So thank you all. And with that, Madam Manager, I'll turn it back to you. Thank you.
Thank you, Margarita. And I would be remiss if I didn't mention the University of New Mexico Hospital. Without them, really, we couldn't have done this, and we really appreciate the excellent partnership that we have with them. So I just want to thank you all for joining us today. We look forward to keeping you apprised of all the continued progress that we're making here at the CARES campus. And I encourage everybody to visit the website www.bernco.gov/DBHS to learn about the behavioral health services programs. And at this time, if the media, community members, or providers, if they have any questions, I suppose that they can go ahead and log in here, but and ask the questions, I guess, on the chat, I'm assuming. So just once again, I just want to thank you all for being here, and we will now be providing tours, but before that, we're going to do the ribbon cutting. That's the neatest part. So if you all can join us, our elected officials from the city, Chair Piscotti, Chief Margarita, again, we just want to thank you all for joining us. Have a great day, and thank you for joining National Recovery and Suicide Month with us. I'll stand here. We'll do it together. Okay.
Look up for a picture first. 1, 2, 3. 1, 2, 3. Okay. Go for it. 2, 3, now. Woo! Woohoo!
Okay. All right. So we will, we're gonna take the camera, we're gonna do a tour.
I have it before it was
In
done, I
pieces,
guess.
in pieces, huh? All right. All right. Thank you.
You know, I have the other one from the gym.
All right. All right, so we're gonna come into the new unit. Our clients will be accessing the unit through this door or through central intake. So our first stop will be in this hallway. So each of these rooms here are semi-private rooms. So each of these rooms has a capacity to have 2 clients. One on here. Maybe. So each of these rooms has 2 clients. All of the clients who have been in detox 3 to 4 days and are medically stable can move from our open floor into a semi-private room. This is a completely new that was not available prior to this renovation. We'll come to this room that's set up. So as you can see in this room, there's 2 beds and a bathroom. You guys can come on in if you want to speak. So again, the intention of these rooms are to have a safe space with more dignity. When people start to feel better and they don't just have to get their mind sideways all the time, they can come into a more private space, have a space to just kind of de-escalate and be on their own. They can still meet with case managers, come out into our day room. But the sleeping space is more personal and allows for clients to have a little bit more dignity as they are in a safer period of their detox. All right, so these 2 doors that we just walked through here are made as swing doors. So as you can imagine, we need to split the unit between male and female. So we have 2 beds here, 2 beds here, and then 2 additional rooms for 4 more clients. So if we have an even split between 4 females and 4 males, we close that door so that it allows for an even split. If there are only 2 females and 6 males, we close this door. So it again allows for more fluidity and flexibility in those numbers instead of having a hard divide or 1 door, which could potentially leave someone away, exclude them from the option of a private room, or leave rooms vacant when we have clients who are in need of that. So again, it gives us an opportunity to swing this door. So right here, this is our day room. So this is a big open space. Clients will go through group therapy. They'll have group meetings with our case managers. Our public health specialists comes in and provides vaccination trainings, public health awareness and education. Our case managers do case manager groups in here. Oftentimes it's just a space to, again, just have a open area where clients can sit, watch some TV. Again, we meet with our counselors or our clinical staff to provide some clinical work in this space as well. We try to make it open and inviting and less of like correctional and even less clinical. And so specifically the furniture that was purchased with that in mind, in that it didn't look like you were in a jail, but again, had more of that open inviting space. We'll come in this way. This is our centralized nursing station here. So as you can see, the nursing station has clear line of sight to both the day room and our detox unit. So in our previous unit, there's a lot of blind spots, so to speak. But in this centralized nursing station, you have the opportunity to watch clients who are in the day room or clients who are sleeping on the floor and vice versa. So this increased safety precaution is something that we learned from the other space that we were in around really making sure that we have the ability to do that. Without this flexibility, we need additional staff to post in each area. In the behavioral health space, as in many spaces, staffing is hard to go about right now. So these type of interventions and these type of structural modifications allow us the capacity to have a little bit more flexibility as opposed to restricting the amount of clients we have because we're short-staffed. We have these open line of sight and we don't have to restrict the amount of clients because one staff member can supervise both units. So we'll come through here and we come onto the floor. Come on through. So this is our new detox unit. We have the capacity for 40 beds in here. There are 40 beds on the unit right now. On account of COVID, we will have a little bit less than 40. We have had 30 on our current unit. As you can see, these beds are definitely not 6 feet apart from each other. And so what we would space the clients out to have some social distancing. Post-COVID, fast forward, all 40 beds will be available and accessible. These beds are all brand new in addition to the new space. And the purchase of these beds is specifically intentional around needs of clients. We currently have stretchers that are low to the ground. And for many of our clients, it's very difficult to squat down to access the bed and or lift from the ground for a low bed. So we intentionally went through medical grade specific beds with the capacity to potentially cut down some of the beds in the event that we have clients who have an additional medical or seizure risk be lower to the ground as opposed to mitigate their risk of fall from the bed itself. So this gave us the capacity to have that and a real mattress, right? I think you see often in shelter settings or in detox settings, it's like if you've ever been on a gurney in an ambulance, right? It's that very small mattress, but again, really intentional about having a real mattress. Again, in those first 3 days of detox, it is physically painful. And so anything that we can do to make that more comfortable above and beyond a pharmacological intervention, those are the pieces that were brought into this unit. Marcia, anything you can think of that I missed?
So that we allow, and then as people are along, they have say that 3 or 4 days. Then the rooms are available, we have less of you around. We've actually worked with our University Hospital Medical Unit, and we put some sort of things in place, so we decreased the number of people. That used to be a pretty common risk factor, and they have helped us in terms of screening and making sort of client-specific decisions around that, so that we can maintain that large number of safely. The other issue about this space is to try and set it up in a way and to have the flow. The more people you have, the more they interact with each other, and some of those interactions are very positive and some are a little less so. So if you give them more room, that helps. Also, as Margarita said, in the beginning, people are physically quite uncomfortable. And so a little more space, a little more chance to sort of flow through can make a difference.
Any questions on this space? And then we'll go to the maybe less attractive bathrooms. That are less fun to look at, but bathrooms I think are important as well.
Well, my question is again about fall, because I'm kind of a little bit surprised that the little side things that come up on hospital beds. And you mentioned that what I believe I heard you say is that you monitor them closely enough so that they hopefully get to somebody before they fall. But there's a long way between that and that.
Yeah.
So then you also said something about screening. Does that mean the facility does not take patients if you have a high fall?
If it's a matter sort of degree, so we wouldn't rule somebody out based on a fall per se or seizures per se. But if somebody comes in for detox, but they may have some medical issues that are making them more vulnerable, or their detoxification needs are so intense that they really need an inpatient setting, then we can refer, and we also transport. And having a medical staff means that the medical staff can tell us this person is an emergency. You need to call an ambulance, or this person you can take the time that we can safely transport. I think one of the things that's a real value about our program is we go to the hospital and pick people up. We go to the psych emergency center. So you hear about transport medication is a barrier, but the county has invested quite a lot in decreasing it. And I think what Margarita said is the medical staff would assess some people that we could keep who might be more at risk. And the plan would be to identify some beds and maybe even make those beds a little lower.
Right.
But we have as much problem for people who have trouble getting down. So I think the best of both worlds. And then with the medical unit highlighting people, again, we can sort of individualize for those folks, even in the face of some larger numbers. It's a trade-off because the need in the community is really great, but we also want to keep safety alive.
And the screens allow us to identify an alert, right? So if somebody is at high risk, the medical staff will identify it as an alert. We have a red wristband, just like when you're at the hospital, right? And they give you a fall risk or an allergy alert wristband, which cues all of the staff to be extra conscious and aware. We often identify these front beds that are close access for our high-risk clients as well, so that there's immediate access. And even though, again, we have the centralized nursing station, we have a requirement that there is always a staff member on the floor, right? So there always will be staff member on this floor area to making sure that they're checking vital signs, that they're rounding on clients. We really want our clients to feel comfortable and safe in this space. And so having that presence is really important. It even creates a rapport, right? Where sometimes the clients come in and they're here because they feel miserable, but the second they feel better, they want out. But if they've established that relationship with the staff during that hard time, they're more willing to stay for that extended period of time, work with case managers, get in, plugged into housing, get on medication assisted treatment, get into a long-term sustainable care program that really does, again, facilitate that continuity and that collaboration between staff and client.
I would just add that one of the really great things to see is that often clients look out for other clients. So they'll actually come to staff and say, Joe over there is not looking. It's really great to see them support each other.
Or Joe's in the bathroom and he's kind of not making sense. And so the staff knows immediately to go in to provide that support. All right. So we'll peek into the bathroom. Should we do, Tommy, we think male, female?
Male and female.
Let's do the male side, because the male side has urinals, that's the only difference, but we'll come to this side.
Sort of.
Right? Yeah. So again, a bathroom is not usually very exciting to learn about, but I think there's a couple of things that you wouldn't normally think about. As simple as the handles on the door. Okay. So the handles on the door were intentionally chosen because your traditional handle that you can put your hand through can be a ligature risk. So having a handle is just kind of like a pull lever, as opposed to a place where people can put their hand through it, is something that's really thoughtful about mitigating those anti-ligature risks. We here, as a part of the department and with our license, are not considering a psychiatric facility or a psychiatric hospital. So we're not obligated to mitigate every ligature risk, but for us, it was important regardless. Again, it's Suicide Prevention Month, so it's important to always recognize that many of our clients are in their lowest time of their lives, right? And so everything that we can do above and beyond having clear line of sight, having staff, having training, and providing resources, small things like door handles matter. So we did, again, make changes. All the stalls have anti-ligature apparatus inside them. We have showers on one wall, bathrooms on the other wall, and for us, really exciting, doors. Our other unit didn't have doors on the showers, so it was more like a jail setting where you had an open shower space. We have single private showers in the building that people can access now if they request, like if they have trauma, or if they request a private shower. But now all of the clients have access to a private space with a door. And again, just something small to provide that extra piece of dignity is really important for us as well. So yeah. Yep, even the seat has very hard.
No wonder we're shoulders, it's different.
Yeah, yep. So last thing we'll look at is the pharmacy, and we have a staff lounge on that side, but the pharmacy is probably important since it'll be actually on the unit. So all of the clients will be able to dose during MedPass at this window. That's also new and exciting, that clients will have a dedicated space that they can come to the window, as opposed to the nurses often walking around with a little med cup trying to find the client. So safety precautions, pharmacological interventions here as well. So again, a little window for folks to access their meds. I forgot to mention in the semi-private rooms, we also have nurse call buttons. So if they're in a semi-private room and they need help, they can press the call button and that rings immediately to the nurse's station. And so that again is an opportunity to have kind of that further conversation and communication. So peek in the pharmacy on this side. So this is your just dispensing unit here. And then not super exciting yet, but this is our pharmacy here. Yep. So this pharmacy space here, this is going to be the very last thing. Come on in. This will be the very last thing that will be filled with supplies. Our pharmacy is currently on the other space, and the second the pharmacy moves, the clients move, and so we have to coordinate the two. So we intentionally scheduled this grand opening with no clients so that everyone could tour, and we could be in a comfortable space. We will be moving in on the second. The Pyxis will move in, and then the clients will follow. So this space has, per the pharmacy license, it has to be exactly the specs. It has to be climate controlled, fire rated, kind of the whole shebang for the pharmacy license, including video monitoring, because we do have controlled substance and medication assisted treatment that is going to be housed in this pharmacy. This little corridor area is also required with a hand washing station and dispensing space. This does not preclude the medical staff from going to the clients if they're feeling terrible and they go with them to dose. But this window we believe will be really helpful in allowing the nursing staff to not have to pull meds and then transport it somewhere and just again decrease the possible medication errors or any kind of discrepancy. So yeah, this piece is really exciting. This has allowed us to increase the level of acuity of clients that we serve, right? Again, you guys probably hear, I can't take anybody over there, they're too sick, right? But now that we have this medication component and that we have medical staff, we can take clients who are have much higher vital signs or higher acuities because we have the ability to do a pharmacological intervention to keep them safe, as opposed to sending them to the hospital for that care first and then to us. So again, it really decreases the demand on the hospitals, increases the capacity and care of the clients, and then they stay with us throughout that time. All right. Anything else, Marcia? Goodness?
I don't think so.
Hopefully it's exciting.
Yes.
Yep, especially I think if you saw the old unit. If you haven't saw the old unit, we can take you over there right now, just for reference. But yeah, I think it's really exciting. Just down this hall that we just walked through, there's a consultation room right there that will be used by our nurse practitioners and or case managers and or counselors to meet one-on-one. It's a private HIPAA compliant consultation room so that people can have those one-on-one conversations as needed. All of our clients will go to the clinic or the medical observation and treatment unit for assessment with the clinical provider when they get in, and then maintaining throughout those 10 days as needed. But we want them to be, other than going to MOTU, we want them to stay on the unit to access this care. So having this pharmacy here and all the services here is okay. All right,
And you're gonna be up and go, and it's happening on the second?
the second.
That's
Awesome.
2 days.
That's 2
right?
days. Yep. So we're ready, and we've moved everything in here again, with the exception of the pharmacy. Because that's the last thing. If that comes, we're coming, whether it's ready or not. We have to bring the clients have to come with the client, with the pharmacy.
Yeah.
So
They'll get medications at 6 a.m. that morning on the old unit. After that, when they go to lunch, we'll be moving in time for the afternoon next. So it'll happen.
They'll be moving from right next door then, right?
Yep.
Okay, then tell me again, what's gonna happen with that?
So that unit is
Yeah.
going to go through a small renovation.
Mhm.
And as soon as that is completed, the predicted time is about 2 to 3 months.
Mhm.
After that's completed, it'll become our observation and assessment unit. So right now, we have our public inebriate program. That's the public intoxicant program where people can come just because our law enforcement can bring someone because they're drunk at a bus stop or something can come to us.
Mhm.
And that's typically only available at night. So now that observation and assessment unit will be open for 24 hours. And our current capacity pre-COVID is 20 clients. This will triple it. So it'll go from 20 to 60. So it is very much a sobering service, similar to a sobering center model, but it is a sobering service overnight. 23 hours and 59 minutes is the length of time that the client can stay to us. So that'll be a 60 clients on recliner chairs. So it won't be necessarily a full spectrum or a bed, but it'll be a recliner chair area where we will observe them, we will assess them. Some of them will only stay there for a short period of time, and then we'll bring them into detox because they'll be appropriate. Some will only stay there for a short time, and then they'll go into our crisis stabilization unit because they more need that mental health stability than substance-based care. So that observation really is going to be almost a triage area where we can observe clients and help them get connected into one of the 2 units or an outpatient service if that's appropriate.
Wow,
That's pretty awesome.
Yeah.
good plan.
Huge. So that'll be kind of like our air traffic control area, right?
Mhm.
Everyone will come in through those glass doors at the front. They'll get a basic triage, they'll come in and then they'll stay. It's not uncommon for someone to check into detox and then want to discharge in like 3 hours. So this observation unit allows us to observe folks for a little while. And then if they really want to stay in detox is the most appropriate thing for them, we bring them right into detox. If they just want a place to sober up, that's okay too, right? We provide that harm reduction continuum, public health education. So if they say, well, I just want to sober up, we want the case managers to do some motivational interviewing, encourage them to stay, encourage them to access other supports. But all of these services are voluntary. Someone wants to leave, we want to let them leave, but we want to provide the option and the resource and connectivity if they're ready. And when they're ready, we're here to catch them.
So, I was one of several people who went to Arizona, to Tucson and Phoenix 2 years ago,
Mhm.
where they actually do, I believe, they do keep somebody for, is it 24 hours?
Yep.
The law allows them to take, to keep them in place for 24 hours. I don't know how strong they
Correct.
insist on that,
Correct.
but that's what they try to go by.
Yep.
And I can see I can see that from many different angles, the good and the bad of that, but has the county considered doing that?
So
Trying to hold somebody for 24 hours just as a matter of,
Mhm. So in New
Awesome.
Mexico, the law does not allow us to do that at the moment. The statute, there are AOT statutes that allow for AOT, which is the program you're talking about, Tucson, but it doesn't quite have the same teeth, so to speak, as it does in Tucson that actually allows for that involuntary commitment to a unit. Here in this unit, both in detox and in our crisis unit, we maintain the voluntary capacity based off of our state licensure through the Department of Health and the statute that's tied to that licensure and the reg that's tied to that last licensure. And we do also believe as a modality that voluntary care through a social model, which is what we provide, is the most appropriate level of care and the criteria that we provide. I think we work very well with our partners, especially at the University of New Mexico Hospital, have a higher clinical capacity for clients who have that, the need for that involuntary commitment. I think you guys know this better than most, right? We have to build a full continuum to make sure that there is capacity for folks who are really sick and maybe don't know that they're sick and need that higher level of required support, all the way through clients who are very low on that threshold, who are just beginning to dip their toe in the need of, you know, first episode psychosis, or in the space of substance use disorders. And so again, this helps us to start that continuum and continue the dialogue with our partners like UNM and others, when and if the state were to allow an involuntary type of care.
One thing I would say about the involuntary is in the short term that can look like a good thing. Having spent some time working with people who are involuntarily committed to treatment, they spend most of their time being really angry about the involuntary. And it is not a good environment for sort of developing a working relationship. The issue is people come to us often more than once. And I think it's what we do in those first rounds that then brings them back. And I will tell you, some people do a long-term, come for the 23 hours, maybe eventually after several times go to detox. And we've had a few who then have entered into long-term recovery. And as much as we've learned about addiction, I have worked in the field for, I'm not going to tell you how many more years. What I know I can't do is predict who's going to be ready, I think is the term. I can't tell. If I go by what I think, I go, oh goodness, I'm not sure this person is ready. And they have taught me to be very humble about any such predictions. So although we can see in the short term some advantages to sort of the involuntary, over the long term, I think the consequences outweigh the benefits.
Yeah.
It's a difficult choice.
Yeah.
It really is.
I'm hoping now that we're building some of that continuum, we'll get to a place where we may not need it as much, right? Because we can really increase our capacity of who we serve and really plug people into care pre and post crisis, as opposed to constantly just focusing on crisis. All right.
Great.